Welcome to Reverse Heart Disease Naturally. I'm Dr. David DeRose, President of Compass Health Consulting, and your guide on this journey into how you can obtain better health. The year was 1990, the date, July 21st. The medical journal in question, the British journal, The Lancet, internationally acclaimed journal. In that journal, on that particular date, there was a provocative question raised: can lifestyle changes reverse coronary heart disease? I'm sure if you asked the average physician before that article was published, they would have said, no way. Coronary heart disease, that's the cause of heart attack. That progressive disease process could only be treated with things like medications and coronary artery bypass grafting. But the study revealed something remarkable. Dr. Dean Ornish and colleagues published the results, the one-year results of what they called the LifeStart Heart Trial. What they demonstrated is that in over 80% of the subjects in this study, there was blockage regression. In other words, the blockages were going in the reverse direction. The arteries were opening up. This was amazing, and the medical community took note. Now, it's true, there were smaller centers throughout the world and here in the United States that were already suggesting that coronary artery disease was reversible, but this was the first ironclad study that documented it. They did before and after angiograms, those dye studies of the heart blood vessels, actually showing that the blockages were going in the opposite direction as everyone had expected. What did Ornish and his team do? What was the lifestyle program that was involved? Before we look at it, let me tell you, this is just one in an episode of presentations from the LifeStart seminars. It might come as no surprise to you that LifeStart is an acronym, a memory device that points to 9 essential lifestyle practices that can reverse or prevent a host of diseases. And you'll see as we go through Dr. Ornish's program some amazing resonance with the LifeStart mnemonic. If it's your first time listening to one of these presentations, let me quickly walk you through those 9 elements in LifeStart. The L stands for liquids, the proper beverages. The I stands for interpersonal relations or interpersonal relationships. The F stands for foods, dietary choices, that is. E stands for exercise. S for sunlight. T for temperance. That's the idea of using things that are good in moderation and totally avoiding things that are harmful. The A in LifeStart refers to air, fresh air. The R stands for rest, and the T stands for trust in divine power. If you're not familiar with that mnemonic, then I encourage you to go to our website, lifestartseminars.com, and pick up our free ebook on LifeStart. It'll walk you through and give you more information about those essential elements. But with that background, now let's go back to 1990 and to Dr. Ornish and his team. What did they do to reverse heart disease? Well, first of all, they did focus on that F in LifeStart. They focused on foods, on diet. No animal products were allowed except for egg whites and non-fat dairy. We'll talk perhaps a little bit more about that as we go along, but one aside is worth mentioning at this point. Dr. Ornish has continued to do cutting-edge lifestyle research, moving his focus to cancer. And now Ornish is using an exclusively vegetarian diet, sometimes referred to as a vegan diet, in his interventions. But back then, in the Lifestyle Heart Trial, they did allow some egg whites and non-fat dairy. What did the diet look like as far as its nutrient composition? It was 70 to 75% carbohydrates. Yes, a very high carb diet, but it was primarily what we call complex carbohydrates. That's the kind of carbohydrates you find in whole grains, the kind of carbohydrates you find in beans. It's not the kind of carbohydrates you find in candy, which is simple carbohydrate, sugar, for example. The diet was about 10 to 15% protein, so you could see it was very low in fat, and there was basically no cholesterol, less than 5 milligrams of cholesterol, which was really an infinitesimal amount. But they did have some other restrictions that we would say are dietary restrictions in the broadest sense. Under the LifeStart acronym, it comes under the heading of liquids. No caffeinated beverages were allowed, and alcohol use was restricted. Now, I've never understood why Ornish did not allow the caffeine. By the way, I'm totally in harmony with that recommendation, and so is the entire LifeStart approach. I don't know if he avoided it because caffeine in some studies has been linked to higher cholesterol levels. I don't know if his main motivation was that caffeine destabilizes the heart. It leaves you more susceptible to heart rhythm problems. And by the way, this is a great time for an aside on this topic. If you have heart rhythm problems, if you have atrial fibrillation intermittently, if you have a condition called paroxysmal atrial tachycardia. You say, whoa, what is that? If you've never heard of it before, I know that's quite a mouthful. Paroxysmal means it comes and goes. Atrial refers to the upper chambers of the heart. Tachycardia is a fast heart rate. So PAT, or paroxysmal atrial tachycardia, sometimes called paroxysmal supraventricular tachycardia, and again, supraventricular because it's from structures above the ventricles, which are the main pumping chambers. This condition is fairly common in healthy people, and one of the things that can trigger it or make you more predisposed to it is caffeine. So although we're talking about reversing heart disease, we usually talk about that in terms of reversing blockages in heart arteries. You can also reverse heart rhythm problems by paying attention to our beverage choices. Caffeine is a big one. So is alcohol. One of the things that can trigger atrial fibrillation is heavy alcohol use. Then coming off the alcohol, this can trigger atrial fibrillation, which is a quivering of the upper chambers of the heart. By the way, if you do have atrial fibrillation, it's very important that you keep on top of that. When those upper chambers are quivering, they're not pumping in a physiologic way. And because of that, blood can stagnate in the atria. And then if they do go back to a normal rhythm, or even if they don't, those clots, remember, stagnating blood can clot. Those clots that could form in that setting can break loose and then go to the body or to the brain, cause a stroke or other problems. So heart rhythm problems can be serious. Heart rhythm problems affecting the lower chambers of the heart, the ventricles, often cause death. You've heard of ventricular tachycardia perhaps, or ventricular fibrillation. If your ventricles, the main pumping chambers, are just quivering, you actually will die, because you're not pumping blood through your body. I mean, you've got to rapidly get out of that rhythm. That's why we use those electric paddles or the defibrillators that are more contained, that even a layperson can use. Why? To try to shock the heart out of that abnormal rhythm. Simple point. Ornish avoided both caffeine and alcohol, and I'm just telling you, there's all these relationships with those drugs, that's what they really are, caffeine and alcohol, that can adversely affect cardiac performance. But again, I don't know why Dr. Ornish and his team excluded some of those things or restricted them in the case of alcohol. I do know this, though. Caffeine has been dubbed bad habit glue. And many psychological researchers feel that if you're giving someone caffeine or allowing them to use it, it makes it more difficult for them to break bad habits. So whatever the motivation was, no caffeine, restricted alcohol use. By the way, the LifeStart program, and in my own practice over the past 30 years, I have recommended that my patients totally discontinue the use of alcohol. It does not give any benefit for the heart if you're already on an excellent lifestyle. That means doing the kind of things that Dr. Ornish and his team recommended, eating lots of plant products and little, if any, animal products. One interesting thing, though, and I should let you know this, if this sounds like too austere a diet, Dr. Ornish's team did not restrict calories at all. People could eat all they wanted as long as they followed those specific dietary guidelines. Well, it wasn't just a diet program. Remember, it was the Lifestyle Heart program. They included other components as well. There was stress management training. There was social and emotional support. Are you listening? From the standpoint of LifeStart, remember, L stands for liquids. We've talked about those already. The I stands for what? Interpersonal relationships. And Ornish focused directly on that. Actually, in subsequent writing that Ornish has done for the lay press, he has suggested that perhaps the very most important thing was the social support, the love, the emotional support that people received in that context. Let's go on, though. Other elements of the Lifestyle Heart trial: smoking cessation. No smoking allowed. Listen, if you haven't heard enough about the reasons to stop smoking, by the way, the minute you stop smoking, I'm exaggerating a little bit, but within hours to days of stopping smoking, your risk of dying from a heart attack drops something like by 50%. The reason for it is nicotine itself, just like caffeine and alcohol that we talked about, nicotine, I'm not saying in an equal manner, perhaps even more seriously, destabilizes the heart rhythm. And so if you have a heart attack as a smoker, with that nicotine on board, you are more likely to die of a fatal heart rhythm problem. So smoking cessation was off the list. By the way, cigarette smoking, with its ingredients like carbon monoxide, damage the lining cells of the arteries in your body. We call it the endothelium. And so that carbon monoxide damaging the lining, making it easier for the blockage that we call atherosclerosis to build up. Remember, Lifestyle Heart trials showed a reversal of blockage. If you're going to reverse blockage, you have to stop all the things that were contributing to the blockage in the first place, which includes cigarette smoking. So no smoking on Ornish's program. Another element that you shouldn't be surprised by that was in the program was moderate exercise. What did that look like? Ornish's team required the participants to walk at least 3 hours per week and at least 30 minutes per session. It was moderate exercise, though. It wasn't severe, strenuous exercise. You know, at this point, I should tell you a story that I heard from one of Dr. Ornish's colleagues, one of the co-authors of that paper, Dr. Sherwitz. Dr. Sherwitz, shortly after the study came out, was speaking to a group of health professionals. I was in that audience, and he told a fascinating story about their work with lifestyle interventions prior to the Lifestyle Heart trial. They were on the mindset that many people were on back then, and by the way, some still are, that it's best for your heart to work as hard as you can. Get your money's worth. You know, if you're going to the health club, you got to just work as hard as you can. You're going to be there 30 minutes, get all you can. I mean, after all, it's expensive to have a health club membership. Listen, I've had many patients over the years who had that attitude, but let me just tell you what Dr. Sherwitz and his team found in their experience. One day they were working with patients, heart patients, with that very philosophy. Get as much as you can. Do as much as you can. And one of the participants who had really caught that spirit was just going at it. He was on the rowing machine. He was going. And it was what was considered a very high-tech rowing machine. Now, this was back in the 80s. And these high-tech rowing machines, he was looking right in front of him at a monitor. And on that monitor were other rowers. And as he was rowing, he was passing one rower and then another rower. And he was just going for it. He finally, at the end of his workout, he got up and he said, "I just beat 100 rowers." And he dropped dead. That's right, he dropped dead. And they couldn't resuscitate him. You could see why this dampened the enthusiasm of the Ornish team when it came to vigorous, maximal exercise. You get the point? I am not an advocate of it for another number of reasons. If you've seen my series on Longevity Plus, where I speak about blood fluidity, you do excessive exercise, it makes the blood less fluid. Maybe you've seen my book, Evading Ebola. You've heard my presentations about improving the immune system, like addressing colds and flu. In there, I talk about the same phenomenon. Do excessive exercise, it suppresses the immune system. Moderate exercise improves it. By the way, while we're speaking about some of those other resources, if you haven't been to the LifeStart website, we've got lots of resources there for you, many of them free. We also have some that there's a fee attached to, some of the video series and books, lifestartseminars.com. But back to the point about exercise. Exercise in moderation is great from the standpoint of just about everything we look at. But when you push it too hard, you'll lose the benefits. So Ornish had recognized that. Fortunately, by the time of the Lifestyle Heart Trial, and as a result, moderate exercise was the rule. Well, I already told you what happened. We saw reverses and blockages, but there were some other exciting things that happened. And those exciting things actually help us understand why lifestyle is so powerful. Before we go there, lest you think this was just a one-year study and after that everyone just deteriorated, Dr. Ornish subsequently published research 5 years after the intervention and showed the same thing was happening. Reversal was continuing to occur over time as people stuck with a healthy lifestyle. So, why the benefits? What happened? One of the things that was so powerful about the Lifestyle Heart Trial was what happened to cholesterol. Some of you are listening to this presentation, you have high cholesterol, you're on medications, but without any medication at all, they were able to drop the cholesterol in the range, the bad cholesterol in the range of 40%. 40% in 1 year. Do you realize how much that is? I mean, this is a huge reduction in cholesterol. So if you start with a cholesterol of 300, do you know what 40% is? That's 120 points. That's going from 300 to 180. That would be if we're talking about a change in total cholesterol. The biggest changes were in the bad cholesterol, the LDL cholesterol. That was where they were approaching 40%. The total cholesterol dropping about 25%. Body weight dropped. Blood pressure fell, which was good because high blood pressure accelerates blockages in heart arteries. So just amazing benefits, and it was occurring all, remember, with lifestyle processes. And so when we talk to you about LifeStart, or you hear about the Lifestyle Heart Program of Dr. Ornish, it's the same big picture that you can change the future of your heart health by changing your lifestyle. Well, you say, yeah, Dr. DeRose, I could change my lifestyle. But if I got on a lifestyle like that, I would be miserable for the rest of my life. Why would I want to do that? I'd rather die a little bit sooner, or even a lot sooner, rather than have to be a vegetarian, exercise every day, stop smoking, get rid of my caffeine. Well, let me ask you the question. Dr. Ornish and his team actually looked at the quality of life of the participants in this study. If you're right about leaving off all your enjoyable habits, making life miserable, is that what they found? Actually, they found just the opposite. They found those in the conventional group, their sense of well-being actually deteriorated over time because there was a control group for this study. The interventional group, they actually improved. Now, I like to be real precise in what I communicate. And I think if you actually looked at what we call the statistical significance of those changes, the group that was the control group didn't change significantly, okay? So at a year, there was a suggestion maybe they were worse, but statistically, probably we would just call it the same. And we have to do that in research, and in fairness, I'll just put that out there for you. But the point was that when it came to things like anxiety and depression and insomnia and lack of pleasure in life, all of those things got better in those that embraced the comprehensive lifestyle program. Here's the point. Although we get attached to the lifestyles that we grew up with, the lifestyles that we've adopted over the years, we can change our lifestyle and develop new enjoyments, plus get the benefits of that new lifestyle. If you've seen my presentation in this series on addictions, you've heard that concept before. If you've seen my series, my mini-series on changing bad habits for good, that's what we talk about. But you don't need to go to any of those resources to catch this point, because I really want you to hear this. You can develop new enjoyments. The things that you enjoy today do not have to be the things you enjoy 10 years from now. You can develop an enjoyment for plant foods. Listen, I know this personally. I was not raised a vegetarian. In fact, I never even knew a vegetarian growing up. But for over 30 years, I've been on that diet and experiencing the benefits from it. I don't miss all those hamburgers I used to eat. Even if I can't use proper English, all those hamburgers I used to eat. You got it. But you got the message, right? The point is simply this: we can develop new enjoyments. Well, let's take a closer look at foods since we're speaking about those. After Ornish published his study, a very interesting paper appeared in the American Heart Journal about 5 years later. The author was William C. Roberts, a prolific cardiologist, author, editor, one of the real pioneers, one of the real leaders in the cardiology community. Let me read you something that Dr. Roberts wrote. You may want to follow along with me. Not many persons in the Western world are desirous, however, of becoming vegetarians, either pure vegans or ovo-lacto type, but that should be our goal. Standard Cardiology Journal. And what is this prestigious author saying? Based on research like that of Dr. Ornish and his colleagues, he's saying that we should focus our attention on being vegetarians. But Roberts didn't stop there in the paper. I can remember reading this some years ago, and he took some pretty bold positions. He put it this way. He said, human beings clearly have more characteristics of herbivores than carnivores. And he actually, I believe, printed this graphic that I've reproduced for you here in the paper. I think it was actually published as a table. It's been a while since I actually looked at the original, and I know I've used this table in my lectures before. But take a look with me at this graphic that Dr. Roberts constructed. He's looking at similarities and differences between carnivores and herbivores, and he's making a case that human beings are designed to eat primarily plant products. Do you see it? The carnivores typically have claws, whereas herbivores have hands or hooves. When it comes to teeth, the carnivores have sharp teeth, whereas the herbivores have mainly flat teeth for grinding. That's like what we have as humans. The intestinal tract of carnivorous animals is short. We, as you probably know, have a very long intestinal tract like other herbivores. And then he gives other examples you can see there in the table about how we drink water, how we cool our bodies, sweating rather than panting, etc., and our need to get vitamin C from our diet rather than being able to make our own. Interesting, isn't it, to see this in a cutting-edge cardiology journal? Well, you say this is all very interesting, but it doesn't sound like what my doctors have told me. It doesn't sound like what the dietitian has told me. By the way, more and more doctors and dietitians are recommending the vegetarian diet for reversal of coronary artery disease. But many still say, oh, you know, it's okay to have the egg whites. It's okay to have the skim milk. You can have a little bit of fish and chicken. Let me just put things in perspective for you, because this is really old data. And I'm speaking 70s, 80s, where people thought there wasn't much problem with things like animal protein. You see, if you're trying to focus on lowering your cholesterol, it is not only important to get the cholesterol out of your diet, and that's found only in animal products. It's not only important to get the saturated fat as low as possible in the diet, and that is found primarily in animal products. But it is also important to boost the dietary fiber, and that is only found in plant products. So you've got to eat those plant foods for the fiber, but we're just going a step beyond now because animal protein raises cholesterol. That's right. Even if you take away all the saturated fat, all the cholesterol, you take away the fact that animal products have no fiber, skim milk is not an ideal food for your cholesterol. Yes, it's better than whole milk. Yes, it's better than 2% milk. But skim milk will actually raise cholesterol based on its animal protein content. Many studies have shown this, both in animal models and in human studies. If you want some of the references, we have those available in the free companion guide that goes with this. We have a little study guide that goes along with this presentation. You can get that also at LifeStartSeminars.com, LifeStartSeminars.com. But now we need to hasten on. We've talked about some of these cholesterol connections. If you want to lower cholesterol optimally, you do want to be a vegetarian. And maybe I should just tell you this while we're speaking about it. If you look at animal proteins, and this has been done, if you look at animal proteins, you will find that some of the worst proteins are fowl proteins, skim milk protein. That's right. Right there near the top of the list as far as things calculated to raise your blood cholesterol. So eat more of those plant products. Get the animal products as low as possible in your diet. One other bonus now before we finish up, and that has to do with oxidized cholesterol. Oxidized cholesterol is something that's especially damaging. We call it oxidized LDL. It's especially damaging and adds to the buildup of atherosclerosis. Cholesterol can be oxidized in the body, but it can also be oxidized in foods. Anything that has cholesterol in it and then has a long shelf life is especially predisposed to having oxidized cholesterol. For this reason, I recommend that you avoid things like custard mixes, pancake mixes, Parmesan cheese, lard, all these things that sit out for a long time, have cholesterol in them. They are rich sources of oxidized cholesterol that can damage your arteries and add to the buildup of atherosclerosis. Well, we haven't looked at every single element in the LifeStart paradigm, but I think we've looked at enough based on Dr. Ornish's work and on the recommendations of others to help you see that heart disease and high cholesterol are indeed reversible processes. If you're carrying those diagnoses, you are not forced to a life of bypass surgery after bypass surgery or angioplasty after angioplasty. You actually can stop the disease in its tracks and do more than that. Most people can actually reverse the blockages with lifestyle. Again, it's all embodied in that paradigm, LifeStart. You want to learn more? It's all there for you. LifeStartSeminars.com. Take advantage of the free study guide, the free ebook, and if you want even more, we've got often, in many areas, special personalized coaching opportunities over the phone or in person. For all of us at LifeStart Seminars, I'm Dr. David DeRose, wishing you the very best of heart health.